Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking all about levels of consciousness and levels of orientation. So let's get into it. Starting off with defining what's normal, right? What we expect to see on normal, healthy patients. So level of consciousness includes awakeness, alertness, awareness of their surroundings, or if they are asleep, they are in a normal sleep state. So a REM cycle, light sleep, that kind of thing. And if they are asleep, they are easily awoken and alert afterwards. Okay, so this is what we're talking about, normal levels of consciousness and orientation. Now I want to define some altered levels. So confusion. Confusion is disorientation to things like person, place, or time. When we do our head-to-toe assessments on our patients and we ask them their A and O's, right, and we say A and O times 4, what does that stand for? So the A is for alertness, right? And then the orientation, person, place, time, and situation. So person, tell me your name. Do they know who they are? Do you know where you are right now? Can you give me the time? And that doesn't need to be like the time on the clock. That can be the time of day or the date or the month or the year even. You know, you give a little leeway there. And then the situation. Why are you here? So for an example, you can have your person be alert and they can say, my name is Bob Johnson. I'm here in the hospital because I'm having surgery and it is October. Right? And then they get A and O times 4, they get all the credit, everything is good. So if they're unable to do that, they might be in a confused state. Moving on to clouding of consciousness, this is another one that's a little bit more difficult to define. So disturbance in perception or thought that can be either small or moderate in degree. So basically, if your patient has clouding of consciousness, they're a little out of it, okay? So they can be inattentive, they can be kind of, sleepy, not really paying attention to their surroundings. A stupor does not react or is unaware of their surroundings. So a person who is in a stupor is likely to be injured. They're more dangerous. Things can happen to them because they're not paying attention to what's going on. Maybe motionless or completely mute, but still awake. So you're talking to them, you're trying to ask them those 4 questions, and they're just sitting there looking at you, awake, not responding, not moving around. It's like they're not getting it, okay? So that's a stupor. Delirium is confusion plus altered consciousness. So the two of those together can vary, so can be moderate to severe. And some common causes of delirium are infection and head trauma. And then a dream-like state. This is a disturbed consciousness, may or may not be aware of their surroundings. And then these patients can also have hallucinations on top of it. So this can be dangerous. And a dream-like state can last anywhere from a few minutes, few hours, to even a few days. So our biggest concern when we're talking about these altered levels of consciousness for our patients is their safety, right? Because we don't want them to get injured, we don't want them to get hurt. A few more types, and these are going to be associated more with sleepiness. So lethargy is severe drowsiness, but these patients are able to be awoken by moderate stimuli. So maybe if you say, hey, Mr. Johnson, they won't respond, but if you shake them, they'll respond and they'll wake up. Okay, so they're very sleepy. You can wake them up, but then they'll fall back to sleep easily. Obtundation, this is a more severe form of lethargy. So these patients aren't so easily woken up. So they have diminished responses to stimuli. So even if you shake them and say, hey, 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 wake up, they're not going to respond to you. And these patients will also be sleepy more often, so they'll sleep more than normal. And then finally, a coma patient. So a coma patient is completely unarousable and unresponsive. Okay, so think of these almost like they go in levels. So they're very sleepy, but you can wake them up. they're harder to wake up, but you can still. And then with coma patients, you can't wake them up. So some common causes of comas: acid-base imbalances, issues with your oxygen or glucose levels, drug overdose, maybe you've had an intracranial hemorrhage, you've had a stroke, maybe you have some sort of infection, meningitis, things like that. Lots of different causes for coma. When it comes to caring for these patients, you really only have to do 2 steps. So the first step is determining that level of consciousness. So that's why we went through all the various types. Then after we figure out what kind they have or what level they're at, find out the cause. And there can be lots of different causes for these things. So how do we find the cause? A couple things. First, get a history on them. Now, I said history if available, right? So if your patient is unconscious, right, or if they're confused, they're not going to be a good reporter, they're not able to answer your questions appropriately, we're not going to get a history from them. Where are we going to get it? Maybe from their chart, from their records, maybe the person that came with them to the hospital, their caregiver or their loved one can tell you, oh, you know, they fell off the ladder and hit their head. Okay, well that's the cause, right? That's the history. So the history is going to be super helpful if you have any sort of history available to you. Other things, vital signs. So their vitals can suggest various causes. Things like increased intracranial pressure, shock, right? Infection. So vitals can show us that there are those kinds of problems. And then of course, a solid head to toe assessment can also help us determine the cause. So things like any obvious signs of injury. So the history, they fell off the ladder and hit their head. Well, we're going to see they're bleeding from the head, right? Things go together. Is there an odor? Do they smell like alcohol? Maybe there's a connection there, okay? What about their pupils? Are their pupils really dilated? Are they really pinpoint? Maybe suggest they're under the influence of substances. Do they have a stiff neck? That could suggest infection like meningitis. Do they look pale? Right? Do they have pale mucous membranes? Their lips pale? That could suggest things like anemia. So stuff like that. So getting a good history, if you can, their vitals and their head to toe, that's what's going to help us determine the cause, because we can't treat it unless we know the cause. So figuring out the cause after we determine their level of consciousness. I also wanted to discuss the ACPO score. So this can be used in an emergent situation if your patient has an issue with their level of consciousness because of like a stroke or a head injury. So what this checks for is alertness. So are they alert? ANO times 4. Are they having acute confusion? So they were fine just a moment ago, but now because of whatever happens, they're having a confused state. Do they respond to voice? So what does response mean? It can mean like responding back to you verbally, if you ask them a question, or it could mean if they're like asleep, opening their eyes when you talk to them. So responding to you in some way, acknowledging that stimulation, that sound. Maybe they don't respond to voice. Maybe that's not enough to get them to wake up. Response to pain. So pain would be like a trapezius pinch or something like that to get them to respond to you. And then finally, unresponsive is no matter what you do. They don't respond to pain, they don't respond to voice, nothing. So this is a really quick tool that you can use on your patient who might have an altered level of consciousness to kind of determine where they're at right now. And that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.